Hi, everyone. Henry DeVries, Health Authority TV, and I write for the California Business Journal, and I'm a book publisher, and we have an imprint called Health Authority Books. And we like to bring health authorities on, shine a spotlight on them, hear what they're thinking, and I'm very pleased that we have Ryan Lilly with us today. Ryan, please introduce yourself.
Awesome. Thank you for having me, Henry. Ryan Lilly. I lead the healthcare division of Mike Worldwide, MWW Health. Mike Worldwide is one of the largest privately held PR, comms, creative agencies in the world. And I head up all of our healthcare things, hospitals and health systems, pharma, health tech, innovation, wearables, everything healthcare. And that's where I've spent my whole career. So that's kind of where I'm coming from: comms, reputation, brand perspective, all things healthcare.
I'm curious, what do you do for your clients?
Yeah, it's a very broad range. Everything from, proactive brand building, awareness building, conversion marketing, all those things, to crisis management, reputation management, and even on the creative end of things, content production, advertising, paid media. So really, truly taking on a very broad, comms, brand perception, brand impact sort of role across all of healthcare.
Okay. I'm going to stipulate that you have decades of experience in this. So I'm curious, from your opinion, what can we do to improve healthcare in the United States?
Yeah, that is a big question. And after some decades, one that I've been asked before and have tried to answer before. I've been at this long enough to see sort of cycles of healthcare. How do we solve healthcare in this country? And I think it's pretty easy to identify the issues, the challenges. And I've seen some of these cycles where, Watson won Jeopardy, and then AI and big tech was going to solve healthcare, and that was a long time ago now. And now we're back in AI. I've seen cycles where we're going to bring in outside thinkers into hospitals and health systems that are not clinicians. They're not so tied to sort of this model. And that's playing out now. And it's hard. The reality is it's very hard. It's easy to identify the challenges. It's really hard to address them. If I were to try to answer that big question succinctly and, quickly, I think we have become very good at sick care and reactive care in this country. And a lot of that starts with the financial model. The money behind healthcare for a long time now has been episodic, volume based, fee for service, versus outcomes, which is so unlike other industries. And for people outside of healthcare, I often use an analogy of, you take your car to the garage to get it fixed, and they do diagnostics, and you would get a bill, a big bill for, hey, we did all these things, but we didn't fix your car. Can you pay the bill? That's kind of how healthcare works. And I think we have to get to a place where the objective is to fix the person. And I think a lot of that starts with preventative, getting away from reactive sick care, where we're waiting until somebody is, ill, to try to reactively treat them.
Some people say we are good at prolonging death, and we're not good at preventing the need for the healthcare. So, anything else you want to add before we say adieu?
Yeah, no, I mean, and I think that's very fair. And again, it's tricky, because we are still a hub of innovation. We're still leading, a lot of the world in quality of care, innovation, whether it's procedures, technology. But I think it is the way that we create accessibility to those things to average people. I think that's, access, cost, complexity. I was talking to a colleague, who does the same thing as me in healthcare earlier today, and we were sort of joking that we speak this language day in and day out, but then I find myself or my family at the doctor trying to navigate insurance, care coordination, where do we go next, and even for me, it's very complicated. And so I can only imagine for, folks that are not as close to it, how complicated it is. And I think there are people that unfortunately end up, more sick or worse than they have to because of the complexity and because of the access and cost issues. And so again, that's a huge thing to unravel. But I think if we can start there, let's lead in innovation, let's lead in all the things that we're good at, but try to find a way to make them a little bit more accessible, to everyone, ideally, or to the average person. So, again, big statements, a big question, but I think that is at least the place to start. And then, I think acknowledging as healthcare experts that won't happen overnight. It's not like flipping a switch. There's no silver bullet. But I think as a industry, if we can sort of rally around that, collaborate, and take incremental steps, knowing that it's going to take a little time. I think that's the path forward, and it's a path. It's a road to walk.
Well, thank you so much for taking us along on the journey today. And until next time, keep those patients healthy, wealthy, and wise.
There you go. That's the best we can do, right?
That's the best we can do.
Awesome. Well, thank you, Henry. Appreciate the time and the invite.
Ryan, a delight, and would love to have you back. So until next time, stay tuned to Health Authority TV.